Hi everybody, this is Dr. OG from MP Skills Made Easy Workshops, and you're listening to the Prescriber Essentials podcast, the show that helps you delve into the world of clinical skills and knowledge for clinicians who love to continually improve their clinical skills. I discuss content to help you grow professionally and the opportunities and strategies to provide excellent care like a pro. My name is Dr. OG. Today, I'd like to discuss your annual well visits for your Medicare patients, and then your comprehensive preventative visits for your commercial third-party insurance patients. So let's just go ahead and dig right in. All right, so your annual well visits. And of course, you want to know a couple of things with your annual well visits. One would be that with your Medicare visits, it does occur after the patient's first 12 months of coverage, or the welcome to Medicare visits would occur 12 months after their welcome visit. So again, think about it as the patient comes in for a welcome to Medicare visit, and then after that, they would have the regular annual well visits. Okay. So patients with Medicare Part B are entitled to your initial annual wellness visits. So again, this is something that you definitely want to be familiar with. And then talking a little bit about the code. So the Welcome to Medicare visit code would be your G0402. So that would be the IPPE. So the initial preventative physical exam. Just be aware that this is not billable for your AWV. So the annual well visits. So the IPP is covered only once within the first 12 months of Medicare Part B enrollment. And the goal of the IPPE is really to review medical and social history. Again, think about us as nurse practitioners and physician assistants, promoting the patient's health, educating the patient, making sure that we're thinking about disease prevention and detection. And then, of course, be aware that the initial visit can be offered 12 months after the patient receives the IPPE, or 12 months after the patient was enrolled under Medicare Part B. So again, a subsequent wellness visit will be offered every year. So hopefully this kind of clears it up for you. I know that with Medicare visits, it's a little confusing. So you want to know for sure, you want to know about your AWVs. So the initial preventative physical exam, and then subsequently, every 12 months, the patients would be seen for their AWV, so annual well visits. All right, I want to introduce you to the concept of the Medicare wellness visits and the required components. So knowing what is required of you as a practitioner for your patients. So again, you're required to review the patient's medical records and their social history. Of course, you want to go over the patient's risk factors. So depression screening is a big one. So that would be your cognitive testing that is reimbursed by Medicare. So again, just knowing about the PHQ-9, and of course, you're using the standardized screening tools in your practice. So yeah, you want to also know about the functional ability and the level of safety for the patient. So you're asking questions about, tell me a little bit about your home. Do you live with anyone? Does anyone cook for you? Do you live by yourself? And so in that visit, you're able to actually assess the patient's functional ability and their level of safety. And then, of course, you're conducting your focused physical exam, checking vital signs, height, weight, BMI. If this is a subsequent visit, then you're comparing to the initial visit to see if a patient has lost some weight and so forth. And then visual acuity screening will be something that you definitely want to be aware of and checking the patient's visual acuity. Would they be requiring, glasses, or if they're diabetics, would they be requiring a retinal exam for that year? And so other factors, you want to make sure that you are, documenting the patient's medical and social history. Advanced care planning, that's also important. Again, making sure that this patient consents to this before you even get started. Then, of course, you want to check for any current opioid prescriptions that this patient is taking. educate about, substance use or disorders if a patient, screening and educating, and then, of course, counseling this patient based on their health needs that you identified. So again, this is a little checklist for you. The screening EKG is required or is allowed with interpretation if this patient is in need of that. So let's say the patient has some cardiac dysfunction that you're wanting to assess, then you definitely want to make sure that you're checking this patient's getting an EKG screening. So again, this is just a little cheat sheet for you. And you want to see the components of the initial annual wellness, and then, of course, the subsequent annual wellness. So that would be 12 months after the initial annual wellness visit. All right. So these are some things that are required for you to document, again, for the initial annual wellness visit. So the patient's demographic data, their self-assessment of their health status, psychosocial risks, their behavioral risk, activities of daily living. You want to make sure that you're getting the patient's history. We kind of talked about substance use disorder assessment, getting a list of the patient's healthcare providers and suppliers. So some of your patients that may require some supplies, so, diabetic supplies, or even, think about it, your asthma patients, COPD patients that maybe require nebulizer treatments and things like that. So documenting the patient's weight and height. Cognitive impairment is really important that you document it, because again, this is a way for you to get reimbursed, but also for Medicare to see what's going on with the patients, especially your older adult patients that could be, again, thinking about, if you think about cognitive decline in your older adult patients. And then, of course, depression screening, you'll get reimbursed for that. And then functional ability. And then, of course, the other healthcare screenings that the U.S. Task Force and the CDC recommend. Also think about vaccinations. That's important for you to also discuss at this visit. And then come up with an action plan based on the patient's needs. Okay. All right, we'll just move ahead and talk a little bit about AWV codes. So your annual wellness visit codes. So again, your welcome to Medicare code for Part B patients will be your GO 438. This is a billable code, and then subsequently would be the GO 439. All right, so preventative visits. Again, just being aware that your commercial insurance companies also would pay for your patients to receive preventative visits. And of course, Medicaid plans and Medicare Advantage plans. So patients always appreciate those visits because they're not subject to copays and deductibles. So again, be aware that from age 2, the patients will be, it's going to be covered if a patient does undergo a preventative visits from age 2. All right, we're going to switch gears now and talk about your comprehensive preventative visits. So this is not your Medicare visits. This would be your third-party insurance patients that you're, again, just providing their annual well visits, okay? So comprehensive preventative visits are performed by advanced practitioners, so nurse practitioners and physician assistants, and of course with physicians as well. And you can see the components of the visits. It covers an age and gender appropriate history, performing your physical exam, counseling this patient, anticipatory guidance, risk factor reduction interventions, and then of course your ordering labs and diagnostic procedures that are required. All right, so this would be the code for your preventative visits. So you can see the 99381 to 99387 for your new patients, and then 99391 to 99397 for your established patients. All right, so some more components of the physical exam, and I say physical exam, but it's truly both physical exam and also what is required of you by the U.S. Task Force as a practitioner during the patient's annual well visits. So, again, that would be just a comprehensive physical exam visit. All right, so components of a physical exam for your asymptomatic adult patients would include blood pressure screening, periodic measurements of the patient's BMI. So again, that will be something that you're required to address with this patient. Always trend, and trending means that you're looking at their last visit to see, well, are they gaining weight or have they lost weight? Is there something that you need to address? If they've lost some weight, then you want to address that and ask this patient if this is intentional or not. Then, of course, Pap smears would be for your female patients that are actually sexually active over age 21, so 21 and above, who have a cervix, and this would occur every 3 years up to age 65. And then, of course, mammogram would be required for your patients according to the U.S. Task Force. And so it used to be that, again, age 40 used to be the thing. Patients that have any type of family history of breast cancer, we typically would start them at age 35, or you want to ask them when their, let's say it's their mom that has a history of breast cancer, when their mom was diagnosed with breast cancer, and then you want to tailor that. But it's always a good idea to get a baseline mammogram for these patients, really just to have that documented. And then prostate exam would be for your male patients that are susceptible. So again, African-American males that maybe have a family history of prostate cancer, then you definitely want to be checking their PSA levels. DEXA scan, of course, checking for osteoporosis, cholesterol screening, fecal alcohol blood testing, and colonoscopies will be required of you as a practitioner. And then, of course, we will talk a little bit about clinical breast exam. Again, this is it may be appropriate for your patients for you to perform a clinical breast exam in patients that are high risk. So this will be patients that have a genetic mutations, BRCA1, BRCA2, and patients that have had a history of chest radiation. So patients with the family history of breast cancer would be good candidates for you to perform clinical breast exam. And then, of course, your screening mammogram or diagnostic mammogram and ultrasounds would follow if you detect any abnormalities. And then, of course, your job would be to perform a head-to-toe exam. You're checking at, ordering some blood work for this patient. And then just being aware that your physical exam helps to strengthen the provider-patient relationship, which will greatly provide some benefits to your patients. The patients see you, they know you, they're able to communicate directly with you and ask questions that maybe might be of help to them. And then, of course, your job would be to, make sure that you're advocating for your patients in your practice setting. All right, so we'll move on and talk about selecting a code. So when you're selecting a code, so again, you can see the codes that we use for, between 99202 to 99215, using the new evaluation and management guideline posted by Medicare for office and outpatient services. Providers may use either total time that you spent on the date of the visit or the medical decision making, so the MDM. So again, this would be for some patients that are coming for a well visit, and they're also requiring that you see them for a sick visit. And we'll talk about that in a few slides down the road, and I'll tell you exactly how to code those type of visits. All right, of course, you want to maximize your reimbursement, so be sure that you are completing the screening questions. The patients can actually complete the screening questions while they are waiting for the patient encounter. So make sure that you are, educating your medical assistant, letting them know to, provide this documentation to the patients, with screening questions. Of course, again, the patients can document their BMI, screening for smoking, alcohol use, or even health vital signs, such as, asking patients to estimate how much they exercise, each week, depression, alcohol use, like we talked about, tobacco smoking, like we talked about, any type of STI risk factors and cardiovascular risk factors. So obesity would be one of them, their diets, things like that. So you can see that while this patient is waiting for the patient encounter, they can give you, a lot of information regarding their health. All right, so during the encounter, so now this patient is here to see you, always discuss any positives with appropriate billing code and time documented again. So always document the time that you spend with the patient. And with the new billing and coding, E&M, that you document according to the MDM, so the medical decision making, or the time that you spend with the patient. So you want to also think about the reason for including these questions on the AWV. So again, many counseling services can be billed for just once a year, especially for your Medicare patients. So to maximize preventative services, wellness visits should be set for at least 30 minutes slot, not only to manage whatever chief concerns a patient has, but also to address any positive screening questions. So remember how I mentioned that, when this patient is waiting for you, they already have, a screening questions that they're able to complete while they're waiting. So at the time of the visit, you want to be able to address those. And of course, during the wellness visit, you're counseling this patient about smoking cessation, any type of cardiac risk factors, diet, exercise, limiting sugars, things like that. Even telling them about, adding fiber to their diets, things like that, that you definitely want to make sure that you're addressing with the patients. And then alcohol cessation will be another one. So I want to talk a little bit about modifier 25. So this would be your patients that are coming for an annual well visit, but they would have, let's say, a medical complaint that equates to a sick visit. So I'll give you an example. So let's say your patient comes in for an annual well visit, but they tell you that they have burning when they pee, or that they have a rash that they would like for you to take a look at. So the best way to maximize your reimbursement for this type of services is to document the annual well visit first. And then once you're done with that, add a modifier 25. You do not want to document 99213 plus an annual well visit code, because the sick visit code will not be reimbursed by Medicare or third-party insurance companies. So what will be reimbursed would be that modifier 25 for a sick visit. So again, document the annual well visit, and then document the modifier 25 to receive full reimbursement for the services that you provide. All right, so I just want to go over the billing and coding for preventative services. And I just really want for you to see this real quick, that, you get reimbursed for your cognitive assessment. So we kind of talked about this. So again, patients with your depression screening, patients that have any type of cognitive dysfunction, you want to be able to document that and get reimbursed for that service. Advanced care planning. So again, if you did document discussions about, and the patient actually signed the forms for their medical decision making in terms of, did they discuss any type of advanced directives with you? You want to be able to document that at the time of the initial visits. Depression screening, we kind of talked about that. Smoking cessation, alcohol screening, alcohol counseling, STD screening. You definitely want to discuss all of that. And then cardiovascular screening. So again, if you're ever using the cardiovascular screening tool, you want to be able to document that for your Medicare patients. All right. And then, of course, weight counseling. If you did counsel this patient about their weight, their BMI, if you talked about diet and exercise, if you talked about, maybe sending this patient to see a nutritionist, you definitely want to be able to document. So the thing about it that I really wanted to point out would be, documenting the preventative services, but also seeing the intervals when you can bill for those. So hopefully you can see those, and Medicare would actually reimburse you as long as you're documenting them with a required time interval. All right, so let's go ahead and discuss a case study with a patient that comes in to see you as the practitioner. So this is Miss McDonald. She's a 67-year-old female who presents in an internal medicine clinic for an annual well exam. Okay, she also complains of an elbow pain that she has. So patient has osteoporosis diagnosis, type 2 diabetes. She has diabetic peripheral neuropathy, hypertension, heart failure, and asthma. So this would be the patient's current medications: Entresto, metformin, metoprolol, alendronate. Again, she takes that for her osteoporosis, Symbicort, and gabapentin for her neuropathy. So the question is, what is the role of the advanced practitioner in the clinical management of Ms. McDonald? So remember, she's a Medicare patient. She's here for annual well visits, and I'll share a little tool that we use that would be very helpful for you to know when you have patients that that are in your practice that, you definitely want to go over that, the annual wellness checklist. All right. This is the annual wellness visits practice checklist. Okay. So you can see for your Medicare patients, and you want to verify eligibility before the visits that this patient is actually a Medicare patient. So the things that you're required to do would be to explain the annual well visit to the patient. And then, of course, is this problem list complete? So you'll want to be able to answer those. Is a medication list complete? Is a family history complete? Do we have a list of the patient's other physicians? So if this patient, like, Ms. McDonough that we have, and you can see that she has heart failure. So again, a cardiologist does follow her. So you want to be able to document all the other providers that this patient is seeing. And so during the visit, you want to have this patient complete a depression screen. We always do this with the initial annual well visit only. And then, of course, you want to have this patient complete the functional assessment. So this you want to do initially and then subsequently. So again, are they able to still drive? Do they have people that live with them? Do they live in a one-story building or in an apartment complex? Are they able to, do they have, do they feel safe at home? Do they have rugs that can trip them and, any risk for falls? Their hallways, well lit. So questions like that are important for you to know and ask these patients. And then, of course, you're checking their vital signs and their BMI. You're completing the list of risk factors. You're updating their immunization record. So again, you want to know the immunizations that this patient will require. So pneumococcal vaccination, their shingles vaccination, you want to update all of those. And if a patient requires any Hep B, so again, this would be a visit that you're addressing and ordering immunizations. And then updating the preventative checklist. You also want to make sure that you're, if they're able to detect any issues, any disorders for this visit, make new schedule of preventative and early detection interventions, and then always discuss the patient's advanced directives. If there are any referrals that you made for the patient, so let's say the screening test, so maybe let's say the patient is diabetic and, the patient may need an endocrinologist visit, then that would be a good time for you to, get that screening test done, maybe an A1C, and then send this patient on to see a specialist. Any type of nutritional intervention. So you discussed, diet, you discussed the patient's, decreasing sugars in their diet. Any type of treatment of depression, anxiety, fall prevention, tobacco smoking would be, again, something that you want to make sure that you document that you refer this patient out for. Because this is for a female patient, I want to show you some more additional preventative plan that we have for patients. All right, so for women's preventative wellness plan, so a couple of things that you want to keep in mind would be the patient's BMI is we're checking the BMI, their height and weight annually, checking the blood pressure. You can see that every 2 years. If BP is less than 120, we're checking it annually. If BP is greater than 120, over 80 to 89. Okay, so 120 to 139 over 80 to 89. Vision every 3 years up to age 40, and every 2 years aged in a patient that is 40 and over. Breast cancer screening or mammograms every 2 years, age 50 to 74. Again, cervical cancer screening. This is specifically for your Medicare patients. Okay, guys. So it's a little different. Medicare does things a little differently. So cervical cancer screening, again, they follow the U.S. task force every 3 years and every 5 years. So you can kind of see that osteoporosis. So your DEXA scan routinely every from age 65. And then cholesterol screening, diabetes screening, colorectal cancer screening. So that could be your fecal occult blood stool or a sigmoidoscopy or colonoscopy every 10 years. Then you're screening for STDs, depression screening, alcohol misuse screening, checking their vaccine. So we kind of talked about that. Of course, you want to include pneumonia, flu vaccine, and then also their shingles vaccine for this age group. All right. And then, of course, the referrals, you want to be able to have that as well. We can kind of talk a little bit about, talk more about this patient that we have in front of us. All right. So back to Miss McDonald. So we already see that you're documenting really carefully this patient's diagnosis. You're documenting what is going on with her, the current medications that she's taking. We're documenting all her vaccines. We're documenting so everything that Medicare requires. And I'll tell you guys the easiest way is really to use the screening tool and that checklist, because that way you won't miss anything. Okay, so the role of the advanced practice provider for AWVs and for your Medicare patients, and also even for comprehensive annual well visits for your third-party insurance visits would be the following. So be aware that AWVs is a yearly appointment with patients to identify health risk. You want to be able to decrease this health risk and create an updated personalized preventative plan for the patient. And then also you want to also talk about any type of current opioid prescriptions, detect any cognitive impairment, and then of course you're establishing and updating the patient's medical and family history. Okay, so annual well visits and complaints of, let's say, tendinitis in the case of Miss McDonald. Remember, we kind of talked about this earlier. So you're billing this patient the ICD-10 code. And of course, I say that tendinitis, but also you're billing for the annual well visit, but make sure that you're also including this modifier 25. So you do not really want to put the 99213, even though this is a 99213 visit, you really just want to add that modifier 25 because you did address the annual well visit and the tendinitis for this visit. So you give this patient some NSAIDs really to help out. And then, of course, they will come back and see you. You may want to get an X-ray just to be sure there's no fracture, maybe a hairline fracture. So again, whatever it is that you do with this patient, any diagnostic testing, any type of, blood work or X-rays that you get, you definitely want to document that. But use the modifier 25 to code any sick visits addressed during a wellness visit. All right. So hopefully this was real helpful for you. Again, I just thank you, and thanks for choosing MP Skills Made Easy workshops.
If you like what you hear on the show, then be sure to check out our Prescriber Essentials Academy, which is a continuing education platform where we delve deeper. Visit schools.mpskillsmadeeasy.com to join us. See you on the other side.